Hello, my name is Thomas Musing, here to answer the question that everybody is wondering, and everybody's wondering, and nobody seems to have a good answer to, which is what is the difference between physical medicine and rehabilitation, also known as PMR, or physiatry or rehab medicine, and psychiatry. And I'm going to very briefly explain the differences, the overlap, the intersection between the two, as well as the differences, and I will include other reliable information in the description. So, psychiatry is the branch of medicine that specifically deals with the treatment of the psychiatric conditions that are found in the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, which is currently in its 5th edition text revision. And psychiatric conditions include things such as schizophrenia spectrum illnesses. They include anxiety disorders, of which I have. They they also include disorders of sexual functioning, such as vaginismus, which I do not have, and I cannot have, and many other conditions. There are many fellowship options that one can pursue, and I'm going to list them in no particular order. They're addiction psychiatrist, child and adolescent youth psychiatry. There is and there's forensic psychiatry, which deals with assessment for people who are involved in the courts. Physical medicine rehabilitation is often called physiatry or physiatry. Physical medicine and rehabilitation is a branch of medicine that specifically deals with assisting people with disabilities, and either people who are born with disabilities or people who become disabled, either from long COVID syndrome, from brain injuries, such as cerebral palsy, dystonic cerebral palsy, which I have, um, and uh, um, and and multiple sclerosis, my favorite neurodegenerative disease, which is ALS, and muscular dystrophy, Yeah, the subspecialties that are included in this field include traumatic brain injury, pain management, sports medicine, palliative medicine, spinal cord injury rehabilitation, and cancer rehabilitation. I am not a member of I am not a member of either the American Psychological Association, the American Academy for Psychiatry and Neurology, or the American Academy for Physical Medicine and Rehabilitation, or their osteopathic equivalents. However, this is a 5-minute video about uh, aimed at aimed at getting at the heart of the differences between these very important specialties. Thank you so much for for watching, and many thanks to the team at the University of Washington Medical Center in Seattle, um, uh, f- uh, in Seattle, for taking care of me and for doing a great job of my increasing my quality of life while I'm out here in Seattle